pullback from the mandated vaccines. You're calling this a President Trump boss move. Tell us.
It was the ultimate boss move, and you and I covered it. You know, McCullough Foundation put out an evidence-based comprehensive report October 27th, 2025, linking vaccines to autism. Within 3 weeks, the CDC changes its language on the website saying, you know what, we can't rule it out. Now, within 90 days, Trump orders Jim O'Neill, who's not a doctor and the current acting director of the CDC, to just trim the vaccine schedule. And the current CDC ACIP panel, which is a new panel, they've done little in the first year. I think there was a degree of impatience here. Trump was listening to the mothers of America. In his Truth Social tweet, he said, listen, this is what mothers wanted. Now the U.S. schedule will be similar to that of the countries in Scandinavia, and there's no threat of recurrence of disease. I think we're going to be fine.
I'll tell you, it's so true. You know, my husband retired from the Senate in 2012. Dr. McCullough, and he did the first study on thimerosal. He commissioned it, and that was his deal. Because I remember these mothers lining up at his door of his Senate office every single day. And this has been going on. I'm telling you, that's why I told you the date, because it's so long that mothers and fathers, I don't know why we're leaving them out of this, have been begging, going to every Capitol building they can get their hands on, begging for changes because they've known for a darn long time exactly what happened to their children. No one would listen until now.
It's so true. You know, I give credit to Children's Health Defense and ICANN and Texas for Vaccine Choice, all the state level organizations. The mothers and fathers knew. And in the McCullough Foundation report, we found the published vignettes on this the most powerful. So there was no convincing evidence that, dismissed the association. And I think with a lesser burden of vaccines on children, we should see a reduced, incidence of allergic and neuropsychiatric diseases.
Let's hope so. Let's really, really hope so. All right. I want to